Good evening. Welcome to Chasing the Facts. I'm your host, Sam Chase, and with us this evening is Tami Gouveia, or I should say Dr. Tami Gouveia. She has recently obtained her PhD from Boston University, so congratulations for that. That's quite an achievement.
Thank you.
Tami is one of Chelmsford's 4 state representatives. She represents the 14th Middlesex District, which includes the towns of Carlisle and Concord in their entirety, Acton precincts 1, 2, and 6, and Chelmsford precincts 1 and 9. So it's somewhat gerrymandered. If you took off the 1 and 9 precincts from Chelmsford, you'd have actually a pretty cohesive geographical area, but it's not too bad. And Tami has completed, or almost completed, her first term in office, it's a 2-year term. And in the state legislature presently, we have 160 total representatives. And that the makeup politically is 127 Democrats, 31 Republicans, 1 unenrolled, which maybe we can talk a little bit about that. That really surprised me when I saw that on the website. And according to the state government website, 1 vacancy, I guess, which makes it interesting. And a representative district in Massachusetts comprises roughly 40,000 people. So each representative represents about 40,000 people. And it's a very, very demanding job. And Tami, as I said, is just completing her 2nd year. So you're a veteran now.
Almost,
and
yes.
First question I'm going to ask you is it anything like you expected?
In many ways, yes. I had been a lobbyist for the Tobacco-Free Mass, which is a coalition that works against the industry tactics to hook our kids on tobacco products like vaping products and those kinds of things. So I had already spent quite a bit of time in the legislature, in the State House, and have paid attention to politics really ever since I was in high school and college. So in many ways, it is exactly what I expected. Trying to legislate in the middle of a global pandemic is not anything that I expected. And the scurrying around that so many legislators were doing in March to get a handle on the pandemic, to figure out how to make sure that people had the resources they needed, whether it was rent assistance or the eviction moratorium for a while, or making sure people had access to unemployment. That was very different. That made our lives as state representatives that much busier, because half of our job is legislating, of course, and passing policies. But the other half, and really important part of our job, is constituent services. And if constituents are struggling to get information that they need from a state agency, or just navigating some of the complex systems, that's something that state representative offices really help constituents with. And with the ways that the global pandemic hit us, and the closing of schools and remote learning and everything, there was just a lot that we were really trying to keep up with. And also, as someone who has now a doctorate in public health, but a strong background in public health, I was trying to do a lot to communicate to constituents about, well, what does it mean to have a pandemic, and what does it mean to try to understand the epidemiology of this particular virus, and what's important for us to protect ourselves, protect other people, so that we're really, flattening the curve and trying to control the infection rate and the spread. So that part made it very, very different than what I was expecting.
And that actually, I have to tell you that when this thing hit, you were one of the people I thought of first, actually, because I remembered you had the public health background, and I thought, gee, having a legislator, and there probably are, I'm sure there are other of your colleagues that have similar backgrounds, that's really a plus, if you can have somebody that has that level of understanding, because that certainly was, and still is to a degree, I think, an area of great confusion. People don't understand, and I mean, I'll admit it, I'm certainly not a health person. I'm not that knowledgeable. I have to be guided by what the experts tell me. And if they're wrong, and they have been wrong, hopefully they'll realize it, and then we'll go on to the next thing. I mean, this pandemic thing is a work in progress, really. Mm-hmm. And as we get more information, I think we feel a little bit more comfortable now than we did, say, in March, mm-hmm. That we're doing the right thing. So that's very interesting. Are you satisfied that the legislature, in terms of the way it operates, have they, to your satisfaction, put in the proper protocols? And do you think that pretty much the constituent services and other things that you do are going relatively smoothly given the circumstances?
Yes. So some of the challenges that we have are, I would say that the legislature is relatively behind when it comes to leveraging and using technology and using it well. There are some offices, my own office included, that sometimes the internet, when we are physically in the office, is very spotty. So when we transition to people working from home, many staff don't have a work computer, so they'd have to use their own computer. So trying to navigate and figure out the use of resources, and there are a lot of important ethical limitations put in place on, can you go out and buy your staff a computer or not, and all those kinds of things. But it did make, in the beginning, it really challenging. And that was one of the challenges, in all honesty, with us getting the unemployment system back up and running really quickly. We were lucky in the state of Massachusetts in that so much of our work had already been done, put online. But when you're talking about working remotely, hiring new staff to process the high volume of applications, that really slowed things down in the beginning. And that's on the administration side, and I know that wasn't your question, but it is really part of the story, because then it does, as I already indicated, fall back on state rep offices and state senate offices to try to help constituents navigate those systems and where they might be hitting roadblocks. So on the use of technology, I think we've been a little bit behind. Once the governor declares a state of emergency, it's much more efficient for the governor to legislate from the level of authority that declaring a state of emergency gives him or her. And so where I have been a little bit frustrated is when I feel like the governor hasn't moved as quickly enough as we should have. I was one of the early people advocating for the closure of schools to make sure that we were not spreading coronavirus through young people going to school and teachers and administrators going to schools, just because of the close-knit environment that the learning center really, the way that it's physically designed.
Right.
And so there have been ways that I think the legislature has abdicated some of the responsibility that we have to the governor because of declaring the state of emergency. But I think what's also important is that the legislature is a deliberative body, and sometimes it's really important that we are going slow and that we're not scurrying too quickly to try to solve some of the problems. That's by design. So I think it's mixed results on that.
I think that's a very good point. And one of the things, I know you've been here, this is your third appearance on the show, and I know we've talked about your focuses that you've had, that you would like to get involved in as a legislature. And just in reviewing, preparing for this program and just making sure that I was up to speed on where you were, I noticed that you've essentially followed through on, at least it looks to me as if you followed through on what you had essentially committed to 2 years ago. And I'm very pleased to see that. And again, I think this is, and I want to make this point to people, because off air, Tami and I were having a little bit of a political discussion about the parties and so forth. And my opinion is this, that Tami is the kind of a legislator that regardless of your political affiliation, you ought to be able to support her and what she's doing. I think a conservative Republican would not have too much difficulty in supporting most of your initiatives. I mean, I see some here, maybe not, but most of them, I think they could, because that's your focus. And it makes, it doesn't surprise me, given your professional background, that's where your focus would be. So Your committees, as I see on the website, the joint committees on children, families, and disabilities, consumer protection, and mental health and substance use. And then you've got the outlier there, which I thought was interesting, Joint Committee on Export Development, which I think that's a very interesting area. And then if you look at Tami's legislative initiatives, again, the bills that she has sponsored and authored fall within those categories, and they are people-focused, I would say. And have I characterized that accurately?
Yeah, definitely. As someone who's been a social worker and a public health person for the past 20, 25 years, I definitely bring that perspective into how I approach legislating. I had spent a good almost 2 decades working on addiction prevention and addiction, increasing access to addiction care. And so a number of my policies relate to that, or they relate to trying to address childhood trauma. And, some of the other issues that I hear a lot from the district on are related to the environment, transportation issues, which we are starting to see some more of the transportation issues now that people are going back to work and coming out of their houses a little bit more. So we're starting to see an uptick in traffic and some of the congestion that was concerning people before the pandemic hit and everybody was, staying at home.
I was looking through some of your the bills that you've sponsored, and again, focused primarily on services, people services and so forth. You've got an act to advance health and well-being for Mass residents. You've got a bill that talks about protecting children from the harms of tobacco and e-cigarettes, which I think is very important. One thing that really intrigued me, though, and for various reasons, was the act that you sponsored, H 1632, an act relative to universal income. And of course I saw that and I thought, well, that's interesting because this certainly isn't a new idea. As a Democrat, it'll probably surprise you to learn that Richard Nixon actually advocated for that back in the early 70s, and that surprises a lot of people. But and I thought it was well reasoned when he did it. Could you talk a little bit about that and how that would be generated initially, and if the program were successful, how that might be implemented and what kind of an impact it might have, and how would we fund it?
Yeah. So the particular piece of legislation that you're referencing there would be a pilot study. We would pick a certain, I think it's 300 is what we put in the bill, families that would be selected at random from diverse communities, and they would each receive $1,000 per month.
Each family?
Each family, no questions asked kind of thing. It's really meant to be an exploratory approach to see what are the spending habits, what are the saving habits that we would see if people had some additional income in their pocket. Because
now, is there an income threshold? That
no income threshold.
Okay.
It's a true universal basic income approach. And there are some programs and other schemes that are similar that are a guaranteed basic income, which are a little bit more graduated depending on what your income level is. And some of the, I don't want to say pushback, but questions we get on this particular bill with making sure that it's guaranteed to everybody is, well, what about people who are incredibly wealthy or have, very high paying jobs? You would capture that on the tax side. So there is still a way to, it's not that everybody's getting, all of this extra income that they may or may not need, or that they may not need, but making sure that we are supporting people who might need the extra additional cash assistance.
But it might also be interesting, if a wealthy family or two are included in this study, it might be interesting just to find out what they would do with the extra
Absolutely.
$1,000, because they wouldn't necessarily need that for basic living expenses. So would they put that back into the economy? Would they put it in the bank? Would they invest it in the stock? I mean, that might be interesting information to have.
Yeah, and a lot of the thinking of giving an additional source of income to low-income people is that oftentimes they do put that right back into the local economy.
Oh, sure.
And so it's really it's an economic driver in a lot of ways.
Course.
And there are people on both sides of the aisle that support this because you also, if you're doing it right, then people don't need to go to 5 different agencies, fill out the same exact form, tell their story 5 different times about why they might need cash assistance from the government. It's just a much more automatic, seamless experience, which is better for our residents and better for government administration of various safety net programs.
You dignify the individual by doing that. If you say, look, we understand that you need, or you may need extra income. Here's $1,000, and we trust you to, for lack of a better term, and I may be criticized for this, but I'm going to say it anyway, to do the right thing, which is to spend the money in those areas of need, if that's what you have. And I think if you don't put the strings on it, if you don't require somebody to fill out 50 forms to get the money, I think you're basically saying to people, we respect you and we trust you.
Right.
And I think that's important.
I think that's really important.
Yeah.
And that's what they're finding in other places where they've tested this out, is that people are spending it or saving it, or they're able to save to buy a new car, because the way our government programs are oftentimes set up, there's a cliff effect. So if you make a little bit too much, then you have to give that money back to the state or the federal government. So we're not supporting families who are low income to be able to create a savings and a safety net for themselves, or to go and buy a better car so they can, drive a little bit further to get to a better paying job. So often the ways that our programs are designed, they are more punishing in many ways. They create a lot of shame, and they do come across as, well, we don't trust you to make the right decisions. And so often it's really the exact opposite. It's just that we haven't created systems that really make it easier for people to make those decisions that people really want to make. People want to be useful. They want to work. They want to contribute to society. But we put up a lot of barriers because we make assumptions about people, why they might be low income or not, or we just judge a lot of times when it's not really it's not strategic for us to be doing that as government agencies.
And it may not have a basis in fact either.
Exactly.
Yeah.
Yeah. So and so I filed something very similar when COVID hit, a cash assistance program to make sure that
H4727.
Great. For those who, particularly those who work in the gig economy, we're seeing this a lot with people who work in the restaurant industry. They're the ones that are, among the hardest hit with the pandemic because of, restaurant closures for so long. And then even though restaurants have come back online, there are so many tipped workers who are not earning the same level that they used to. And so, just trying to move the idea forward of cash assistance without questions. And that's exactly what the federal government did for us, right? Everybody got their stimulus checks, or I know some families are still waiting, but
it was the right thing to do.
That's the idea behind it, exactly. And we're so low as a country compared to what other countries have given their families for the cash assistance, but it's really a way to make sure that people can pay their rent, get their food, pay their health care, all of those things that we need. Well,
as the parent of a young woman who works in a retail industry, cosmetology, hairdresser, my daughter is also married to a young man who owns his own business. So they were both really up against the wall with this situation. And my son-in-law is very smart and very astute, and was on top of the situation and did all the necessary applications and so forth. So they were able to get the assistance. The hair salon was not so fortunate. So we have a sort of a split result story to tell. But in any case, I'm not sure they actually met whatever the criteria was. But my son-in-law's business did, so that worked out well, and he was able to keep going and keep his employees on and so on and so
That's
forth,
great,
which is what
yeah.
the thing was designed for.
Right.
You know? So nothing's perfect, but trying to help and do something is better than doing nothing. And so I'm very happy to see that you sponsor that initiative.
Yeah.
I think that's very important. How's that? One thing I didn't check on was the progress of any of these bills.
Yeah, there isn't strong political appetite for these ideas yet. They are still, to a certain extent, considered a little bit more radical. I think as we see automation continue and see the economic impacts of COVID, maybe we'll be able to get some additional attention paid to this. It was the first year that a universal basic income pilot project was filed as a bill, so I will file it again next session just to keep the conversation going.
Well, I think that's a very good point that you made, and I'll admit, when I first saw that, I thought, well, that is kind of radical. But then you actually get in and you read the bill, and you find out, as Tami has just explained, this isn't a scheme to immediately just start giving people money. They want to design a test pilot program to see how it works. That's pretty reasonable. I mean, I don't consider that particularly radical, but I understand what you're saying. And it's an interesting comment because we said at the beginning of the program, we've got a legislature that's comprised of 127 Democrats and 31 Republicans. And so you would naturally think, well, you know, it's probably lopsided, really lopsided on the liberal side. But correct me if I'm wrong, but my experience with our state legislature is that a lot of those Democrats are pretty conservative.
Absolutely, I would 100%
Am I
agree.
correct in that?
Yes, you are.
So
Yes.
you may look at the titles here of the parties, but I would say that philosophically, it's probably closer. I mean, by label, it's an 80-20 split, but I'm going to guess philosophically, it's probably closer to a 35-65 or maybe even a 60-40 split. Am I too far off?
No, I don't think so.
Okay, so
Yeah.
my message to all my conservative Republican friends out there, you may think that it's a lopsided legislature, but really from a philosophical standpoint, it's not quite so lopsided.
No.
You know, and I think you see that reflected in the vote for statewide and even federal offices in Massachusetts. I mean, the president, the Democrat doesn't win by 80% in Massachusetts. That doesn't happen. So, I mean, I don't think that the party labels really reflect the philosophical point of view.
Depends
of the
on your
legislature.
district of,
Yeah, of course.
but yes,
right.
absolutely, yeah.
So I've always...
It's more mixed than people, it's not a monolith, it's more mixed
think
than
so.
people probably realize.
And you're very astute, and I think most of and I know several of our other legislators who understand that, and I think, you know, you're somebody that you may have a particular philosophical point of view, but you're certainly not going to shut out people
Right.
who don't agree with you on all the political issues. You're going to listen, and you're going to take whatever they have to say, and that's all any of us can expect and hope for.
Absolutely.
Okay? So, and I think that's why I said, going back to what I said initially, people should have a very high comfort level supporting you and your initiatives in the legislature. I want to get to a couple of other things that are continual questions and maybe thorns on the side of many of us. And certainly, it's Chapter 70. And we talked about this a couple of years ago, and you said that when you got going in the legislature, you would certainly come up to speed on that and so on and so forth. So is there any hope or chance for any kind of reform? And I'm not advocating for anything specifically, but where I'm coming from and where a lot of people are coming from is the fact that the formulas for Chapter 70 were designed in the early 90s. So it's almost 30 years old. And the demographics for a lot of the towns that the formulas were originally based on have changed. For example, the town of Westford gets quite a bit more Chapter 70 money than Chelmsford does. And the reason is because when the formulas were developed, Westford was, the school population was exploding.
Right, yeah, high growth, right.
Yeah, and at the time, the Chelmsford population was relatively stable. If you look at the income basis, the people in Westford are richer than the people in Chelmsford, and this has been a sticking point. So I guess my question is, will the legislature at some point at least take a look at modernizing or bringing the formulas up to the current, to match the current demographics of what's going on in the population?
We did that at the end of 2019. We voted on the Student Opportunity Act. And it was supposed to be included, the change in those formulas were supposed to be included in this current budget that has been extended only as supplementals because of the pandemic. I had a budget meeting with Chairman Mikowitz. We're divided into divisions in the chamber, so with my subdivision, and part of the conversation that came through from the members on both sides of the aisle is the need to continue to fund education at the levels that we agreed to in the Student Opportunity Act. And the Student Opportunity Act is, we have a commitment to roll out slowly over a 7-year period. And we're sticking with that 7-year period, according to Chairman Mikowitz. This is what he said today. So we're not, just because of the pandemic, we're not going to say, well, we're not going to start the clock yet. The clock has already started on that to try to write those formulas. I don't know exactly what it means for comparing, Chelmsford to Westford, but the intention with the Student Opportunity Act was to take a look at the health benefits, making sure that we're, funding special education at the level that's really needed for our students and for our administrators, English language learners, and also low-income communities in particular. And because as you pointed out, it had been 30 years since we had updated the formula. So that is in the works. It is something that has already been passed and signed into law, and so we'll just sort of see what the budget implications are moving forward. We are planning right now for a budget shortfall of between $3 and $4 billion. There are some indications that the economy right now is doing okay, but we know that as restaurants are not able to do their outdoor dining, and some of the other large employers have said that they've needed to start laying people off, that we'll continue to see some increases in unemployment. We are starting to see more and more communities, including Chelmsford, that's in the red. What are the implications for that in terms of remote learning, and going fully remote?
Of COVID.
In terms of COVID. So just not in the red in terms of the budget, absolutely, in terms of COVID. There's a lot that is still continuing to shift, and that will continue to shift. And I think what the message that came from leadership in our budget meeting today was just paying attention to those and trying to be prepared for that. We will likely dip into the rainy day fund. We have a very robust rainy day fund compared to a lot of states that have similar budget sizes. I pushed for making sure that we weren't cutting as much as we could, making sure that people can still be housed, have access to food. We know that the number of people who are accessing food pantries has, increased by 100%. So there's a lot to still be really contending with. I know I kind of got off track from your education question.
No, that's fine. That's all
that's
very...
the answer on the education piece, is that we did take that up, and we'll continue to monitor how that's going to get rolled out.
Nothing you say is superfluous. It's all meaningful. So we have about a minute and a half left, and I want to recognize the fact that you are running for re-election, and this is going to be a bitterly contested and hard-fought race. There's no opposition, except maybe a write-in or two. Somebody may choose to do that, but I think it's pretty clear that you'll be re-elected. So, and I'm very, very pleased about that, and I think you've served Chelmsford well. But I will give you a chance in the last minute. We like to do this for anybody running for re-election or election, to look at the camera, as they say, and ask for the vote.
Sure.
And maybe give some reasons why people should vote for you.
Yes. Well, as Sam indicated in the introduction, I had set out to do some very specific things as state representative. First and foremost, to listen, to bring different voices to the table to try to solve problems. I have worked with colleagues on both sides of the aisle to try to move certain issues forward. I have pulled people together, particularly focused on transportation. I pulled together a couple different work groups to make sure that we were doing all that we can to help people get from point A to point B much more quickly, where you're not hitting potholes and those kinds of things. So was successful in that. We passed a bill on the House side focused on telehealth, and one of the things that I really focused on was making sure that people had access to mental health care. So I do hope that you will vote for me on November 3rd in the general election, and I thank you for your support, and please get your mail-in ballots in early if you're voting by mail.
Thank you.